Before dental implants were developed, if someone had a missing tooth, the only option for replacing that tooth with a fixed restoration, a restoration that didn't come in and out of their mouth, was what we call a tooth-supported bridge. In a tooth-supported bridge, the teeth on either side of the missing tooth are prepared in order to receive the replacement. And let me show you what those look like. In a tooth-supported bridge, the teeth on either side of the missing tooth are ground down in order to receive the prosthesis. And for years and years, this was the best that dentistry could offer a patient. It had the advantage of being fixed in place, but it has several disadvantages. First, you've taken a one-tooth problem and made it into a three-tooth problem. You've had to invade the adjacent teeth. Nature designed our teeth beautifully. They have strong protective enamel on the outside. When the teeth are ground down, that enamel is removed. Sometimes when that enamel is removed, the nerve inside the tooth dies and the tooth ends up needing root canal therapy. And finally, what limits the life of a bridge more than anything is the potential for decay. If a patient gets a cavity or tooth decay on either one of the tooth teeth that are supporting the bridge, the whole bridge has to be replaced. You can't change just the one tooth that was missing. Another disadvantage of the dental bridge is that it doesn't replace all the tissues that were lost. So a dental bridge replaces the missing tooth, but it doesn't replace the missing root. The best method for replacing a missing tooth is a dental implant. A dental implant is a titanium replacement for the tooth root that was lost. The dental implant goes into the bone and it fuses with the bone where it becomes anchorage. Then a piece is inserted into the implant called an abutment, and then a crown is placed on top of the abutment. The implant is the best method for replacing a tooth for several reasons. First, it keeps a one-tooth problem a one-tooth problem. Second, the implant stimulates the bone so that the bone doesn't atrophy, it doesn't wither away. And when the patient bites on the implant, it feels like a strong natural tooth. Probably the biggest reason why implants are the #1 method of tooth replacement are their durability. Implants don't get gum disease and they don't get tooth decay. And that's why implants have become so predictable. It replaces all the tissues that were lost, and we see success rates in the high 90% 10, 15, and 20 years later. So implants are a great investment, both short-term and long-term. I urge you to call my office to schedule an appointment for a consultation. We can discuss how implants can help you achieve your oral health goals so you can smile better, feel better, and enjoy life more.